Thank you for joining me, Stephanie Abbu, for this ANN Talk. Self-care isn't selfish, it's essential, just like you. We all know how rewarding nursing can be, yet we also know how tough it can be. Nurses and other healthcare workers are at an increased risk for compassion fatigue and burnout. One of the best ways to combat the feeling of burnout is to take care of yourself. You may have heard the mantra, self-care isn't selfish, and that you can compare self-care to the guidance you get on an airplane. Put oxygen on yourself first, then help others. This all makes sense in our heads, but can feel wrong in our hearts. Self-care matters because you matter. You matter just as much as anyone else, and it's okay to place importance on taking care of yourself. Self-care isn't just the latest trend or a popular hashtag. It's supported by scientific research, and according to the American Nurses Association Code of Ethics, the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. So what is self-care? Self-care is a commitment to personal and spiritual development. It's how we nourish our bodies, minds, and souls. It's the root from which everything else can grow. It's the activities that help you take care of your emotional, mental, and physical health. It's about taking care of you, your needs, your personal well-being. This means that your self-care techniques will be your own and based upon what you need. Some activities may include exercising, hobbies, getting more sleep, or having brunch with your coworkers. They may be big, like a spa day, or small, like reading a book chapter a day. Finding time for self-care shouldn't feel like a chore or stress you out even more. And initially it will feel like one more thing. But over time it will transition to a lifestyle commitment that will make you a better caregiver. The American Nurses Association divides this into 7 key categories. Mental. Intellectual self-care is the expanding or sharing your knowledge. Professionally, you may read a nursing journal, attend a voluntary in-service training, share your knowledge with a coworker, or become a preceptor or mentor. Personally, read a book, explore new sites in your city, listen to a podcast or a TED Talk. Physical. At work, you may take a walk or climb the stairs during a break. Walk from the parking lot instead of taking the shuttle. Pack your lunch and healthy snacks to avoid the vending machine. Invest in supportive shoes. And during your off time, grab a workout at home or at the gym. Take up dance lessons. Get enough sleep. Emotional. Emotional needs at work may include recognizing when you or a colleague does something great, such as a kudos board or sending them a card in the mail. Make the break room a no-work zone and kibosh complaining during break time. Use counseling resources or employee assistance programs to debrief difficult shifts. Personally, look for creative outlets to express your emotions, such as drawing, coloring, playing music. Keep a journal, in particular a gratitude journal, to focus on things you are grateful for. Watch a movie or listen to music. Spiritual. Spiritual self-care may mean connecting with your religious faith or practicing mindfulness activities like meditation. It may mean spending time outside, connecting with and observing nature. Social. At work, focus on social self-care by participating in potluck lunches, celebrate birthdays, sit with someone new during break. Take time during your days off to volunteer with a cause important to you. Grab dinner with a friend. Take a quick weekend trip or an extended vacation. Plan a date with your significant other or a play date with the kiddos. Personal. Personal care may include hobbies, a massage, essential oils, or trying a new cuisine. Professional. Care for yourself is just as important as the care you provide your patients and your teams. So focus on ways to take a break and encourage colleagues to take one too. Offer to help a coworker who looks like they need it, and don't be afraid to ask for help yourself. Write out career goals, both short and long term, and take the first step towards reaching them. As leaders, we have the added responsibility of practicing self-care, role modeling it for those we lead, and encouraging our teams to practice self-care strategies. To be the most effective requires a cognitive shift in our approach. We cannot simply say self-care is important. We have to believe it and live it. Also, think about succession planning. We need to be growing future nurse leaders, yet what is the example of leadership we're showing? When we work 16-hour days, work 7 days a week, never take time off, and appear physically and emotionally exhausted, how can we recruit future leaders? Who would willingly sign up for that? And be realistic with yourself. Does that email have to be answered at 1 a.m.? Can you leave on time today to get to the soccer game, yoga class, or go for a walk in the park before it gets dark? Is there something you can delegate to your team that provides them a growth opportunity and gives you time to focus on self-care? Plan to take days off. I remember a leader who appeared to have it all together, who told me, when you get back from vacation, you should be planning your next one. It gives you something to look forward to. It's more likely to happen if you have a plan, and it's better for your well-being and that of your team. Give yourself the same permission to enjoy your time off as you do the teams you lead. When they ask you for time off, I bet you don't hesitate. Yet you may not give yourself the same grace. Also, have an accountability partner. Having a trusted friend or family member who you've shared your self-goals with will go a long way in helping you achieve them. We all do better when we write things down, share them with others, and have to account for our progress. The good news is, you've taken your first step towards self-care by placing a priority on yourself by listening to this ANN Talk. Now keep the momentum going.